We're to turn now to healthcare's make or break week. President Obama has delayed his trip to Asia so he can be close by the Capitol to convince those final wavering Democrats to pass the bill he's been pushing for the last year. Jake Tapper and John Carr on top of the intense activity at the White House and on Capitol Hill. And we begin with Jake Tapper in the president's closing arguments. And Jake, it is going to be an emotional one today.
That's exactly right, George. President Obama, for his final public push, heads to Ohio today. It's a state he picked so that he could appear alongside a local woman, Natoma Canfield, who struggles with insurance premiums President Obama has been talking about for the last few weeks. But since the president started talking about her story, Canfield's tale has become even more tragic.
The president has been trying to tell her story to the nation.
There's a woman named Natoma Canfield. She's got cancer in Ohio, had to drop her insurance even though it may cost her her house.
Natoma Canfield, a Medina, Ohio cleaning woman and breast cancer survivor, had to drop her Anthem Blue Cross Blue Shield insurance because her monthly premiums kept skyrocketing.
I just could not do it. I just don't earn that much money.
After the president started telling her story, Canfield was rushed to the hospital.
Everything kind of just went blue and gray, and I lost sight and almost collapsed.
She was just diagnosed with leukemia.
And you don't have insurance anymore, right? It
That's
expired
correct, right,
in January?
yes. The thing I was the most afraid of has happened sooner than I thought.
Which is what?
Was what if there would be a catastrophe? And I was in the hospital and had some pretty big medical bills.
The White House says health care reform would help Canfield by bringing down costs and making sure insurers are not able to deny her coverage because of her previous bout with cancer.
But lying in a hospital bed, worrying about how you're going to pay for your bills, that's hard. I know. My mother went through that.
But Republicans say the Democrats' bill will only make health care worse, and Democrats are forcing it through the Congress and on the American people.
If they do this, it's going to poison the well for anything else they would like to achieve this year or thereafter.
And George, Canfield had been invited to introduce the president at today's rally in Ohio, but she's too sick to do so, so her sister will be doing it instead. George?
Okay, Jake, we'll be watching that later today. Let's go to Capitol Hill now. John Carl is there. John, the other reason the president going to Ohio, there are at least 3 or 4 key votes in the state of Ohio. And Democratic leaders were out in force yesterday saying they don't have the votes yet, but they're going to get them. Where exactly are they?
Well, they're definitely still short, George. Here's by the numbers. They need 216 votes to pass this. Now, there were 216 Democrats who are now in the House who voted yes in November on health care reform, but the problem is they're going to lose some of those, maybe 6 or more, which means the focus is now on the 37 Democrats who voted no last time. And we have called all 37 of those Democrats and have yet to find a single one willing to say definitively they will vote yes, although at least a few are saying they're willing to consider it.
That's right. Several of them are saying they're still undecided, and most of those are moderate Democrats who are concerned about cost, but also a couple of liberals.
That's right, including Dennis Kucinich, who you remember, of course, ran for president. He is saying that this bill does not go far enough, and he's inclined still to vote against it. But he's not saying definitively, so he may be in play.